Oh, good people. Today I'm presenting Module 3. These are the medical tests and diagnoses that are performed by doctors to find the cause of your pain. I am Dr. BA Mabaso of Dr. BA Mabaso Incorporated. The bigger picture is that we want to heal the silent killers which are causing all these pains that we are experiencing. My family doctor. This is Dr. Mabaso in his office. Welcome back. So in the past module, we talked about the most common causes of pain. Today we answer a big question. How does the doctor know what is causing my pain? We will look at the most important tests and scans: X-rays, MRI, CT scan, blood test, nerve test, physical examination. Understanding these tests help you feel more confident and less anxious during diagnosis. Here is this doctor explaining to the patient with an illustration of a spine on his tablet, explaining what will be done. Again, another doctor using a tablet to explain to the patient what is going to be done, investigations that are going to be done. Before all these tests are done, first stop is a physical examination. So your doctor may check your posture, test your movement, look for swelling or tenderness, test strength and reflexes, do nerve tension test, ask about your pain history. This gives us a roadmap before ordering any expensive tests. So the physical examination is the first step in the pain diagnosis. This doctor is examining the back and its source of pain. And this doctor is examining the chest of her patient. This doctor is performing a reflex test on the knees. We call this a hammer. This doctor is examining the legs of his patients, the nerves in the legs, and the sensation. Right, let's talk about X-rays. They're usually the first scan done for bone or joint pain. They show us fractures, arthritis, bone alignment, bone joints, bone spares, but they cannot show muscles, nerves, or disc. So X-rays bones only, not nerves, not muscles. This man is standing next to an X-ray scan with bones visible. Okay, an X-ray showing different bones. This X-ray shows osteoarthritis. The cartilage space is narrowed. space between the bones in the knee is narrowed. Again, X-ray showing osteoarthritis. We will now move to MRI scans. MRI shows soft tissues, including muscles, nerves, spinal discs, ligaments, tendons, and inflammation. The best test for herniated discs, sciatica, tendon tears, nerve compression, and soft tissue injuries. Only problem is that it can be very expensive. It may not be necessary for every patient. So, summary, MRI shows soft tissues, discs, nerves, muscles. This shows a woman going to a scanner. Again, a scanner. This MRI image shows a herniated disc pressing on a nerve as a source of pain. Herniated disc. Images generated from MRI or CT scan. Right, you will now move to the CT scan. CT scan is like a more detailed X-ray. It is excellent for complex fractures, bone structure, spine injuries, detecting internal problems after accidents. It's faster than MRI, but not as good for nerves and discs. CT scan detail bones and injuries. Here is a CT scan, and this man will go to this tunnel. Come. Another one going to a CT scan. This is a CT scan image. Shows spinal vertebra. Can also show a bent spine, scoliosis, kyphosis. We'll move to blood tests. They help detect medical conditions that cause pain, such as inflammation, infection, arthritis markers, autoimmune disease, vitamin D deficiency, and diabetes. The common pain-related markers include CRP, ESR, rheumatoid factor, ANA, and HbA1c for diabetes. So the blood test will show inflammation, infection, autoimmune diseases, and diabetes. Picture shows a nurse taking the blood from a patient. Again, phlebotomist is a person who takes the blood from you when you go to a laboratory or doctor's rooms. And here is a sample of blood tubes. CRP, ESR, HbA1c. Next session will explain the nerve test. When nerve pain is suspected, your doctor may order a nerve conduction study, measures how fast nerves carry signals, or EMG, shows how muscles respond to nerve signals. These tests help diagnose diabetic neuropathy, sciatica, pinched nerves, carpal tunnel syndrome, and nerve damage after injury. So the nerve test, EMG and NCS. This man is undergoing a nerve conduction test. Small sensors are attached to the leg. Nerve conduction test. This shows nerve damage. And then the signals, pain signals, are traveling slowly. This will be shown by the nerve conduction test. So when are these tests necessary? Not every pain requires a scan. In fact, many find relief with treatment before needing imaging. Tests are recommended when pain lasts longer than 6 weeks. There is weakness or numbness, there is severe trauma, or there are red flag symptoms, or if the pain does not improve with basic treatment. When do you need a scan? The doctor decides and informs you. Shows the doctor looking at the report. These reports are transmitted electronically to the doctor's office. Another doctor looking at the results of the scans. In conclusion, now you understand the tests that help diagnose pain and what each one is used for. This is knowledge that will guide you in discussion with your doctor and help you make confident decisions. In Module 4, we will talk about medications for pain, which ones are safe, what they do, and how to use them properly. You can now download your worksheets, questions to ask your doctor about investigations, comparison of MRI to X-ray. Thank you for watching. See you in the next lesson. Next module, safe medication management. Again, I present to you with immediate solutions, the best sellers in pain control, the top 3 online. Click to the PDF in the video description. You will see a list with clickable links. And then can buy what most people are buying, what is most popular in pain control. Thank you very much, good people.